this exercise I'm about to show you is going to challenge you, and you're going to find out how well you're able to incorporate breathing with movement, if it's there or if it's not. So stay tuned. Hey, this is Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture and Movement Clinic. It's so important to incorporate your breathing with movement. We all are aware of it. If you do yoga or if you do any exercises, there's certain movements you do in breathing in and certain ones you do when you breathe out. That problem, however, is that most people obviously are breathing because they're alive, but they're not breathing correctly. So this is how you're going to find out if you're actually doing it correctly. So what I want you to do is just go ahead and lay down on the floor. And in this position, bring your arms up. Can you see me? Bring your arms up. And most of the times the chest is lifted up. So we want to bring the thoracic or abdominal diaphragm down. And we want to bring the whole spine on the floor. The problem is a lot of times when the ribs go down, the neck goes up and the lower back is still lifted like this. So the challenge here is to elongate your neck, drop your rib cage towards the floor, and lift your pelvis up. As you're lifting your pelvis up, I want you to think about the abdominal diaphragm and drop it down even more without lowering the top portion. So then, as if you have a strand of pearls on your spine, you want to think about lowering each one of those pearls down one at a time, which I'm doing now. And by the time you get to the very bottom portion of your lower back, you should be able to keep the abdominal diaphragm flat on the ground and not lifted up. And then you should be able to lower your pelvis all the way almost to the tailbone and keep it nice on the ground. If you're able to do that, then you're fine. If you're not, that's an exercise you want to do multiple times a day if you can. If not, maybe once or twice a day, and make sure that that happens. If that does not happen, none of the exercises that you're doing to rehabilitate yourself is going to be working. So that's like the preliminary step to every single exercise. Stretching or strengthening or conditioning, whatever it is that you're doing, this has to happen. If you have no idea how to do this, or if you're really having a hard time doing this and you want to contact the office to find out why, please use one of the methods of contact in the description box. And if you have not subscribed to the channel, this is a time to do so. You can also follow us on Instagram and Facebook for daily postings on different exercises that we're doing. Thanks for watching. Take care.